bringing out the dead. New York is America's coronavirus hotspot. Covid-19 has killed more than 1,500 people across the state. Most of the deaths have been in New York City. Authorities there are ramping up hospital capacity. Across the US, numbers are rising sharply.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very painful 2 weeks.
New York's world-renowned Central Park is normally a haven for walkers and joggers. Now dozens of volunteers have helped to build a field hospital in the park to cope with an expected surge in coronavirus cases.
There's hope that people really care. I think you've seen so many New Yorkers come out here and helping, just that ultimately there's hope out there.
I think it shows the capacity for our healthcare system to reach out and do whatever it takes to take care of the citizens of the United States.
The field hospital in Central Park will be able to take nearly 70 corona patients. The US Open tennis complex will be home to another makeshift emergency clinic. The White House is projecting as many as 240,000 US deaths. Officials say that without social distancing measures now in place, that could have been more than 2 million.
Well, here are some more of the latest developments in this pandemic. China has reported for the first time on numbers of asymptomatic cases. It says 1,300 people have tested positive despite showing no symptoms. The captain of a US aircraft carrier is calling for urgent help to quarantine his crew of 4,000. The Theodore Roosevelt is docked in Guam in the Pacific with the disease spreading rapidly. And a 12-year-old girl has died in Belgium. She's thought to be Europe's youngest victim so far. Meanwhile, France, the UK and Spain all recorded their highest daily death tolls on Tuesday. Well, Spain is one of Europe's worst-hit countries. A record 849 people died there on Tuesday, bringing the country's Covid-19 death toll to more than 8,000. Hospitals are struggling to cope with the overwhelming number of cases and a lack of personal protective equipment like face masks for doctors and nurses. Now, as DW's Jan-Philipp Scholz reports, some private citizens are seizing the initiative to try and help the country's medical professionals.
It takes just minutes to produce the plastic brackets needed for protective masks. Engineer Francisco Torrado has a 3D printer at home. When an initiative in his hometown of Seville was set up to produce masks for medical personnel, he joined in right away. For safety reasons, we met Francisco outside his apartment. His family filmed the video inside their home. He proudly showed us the model that the members of the initiative designed together. The emphasis is on simplicity so that the masks can be produced quickly.
I know that people need this kind of product, this kind of material for self-security because of my own. My wife is a doctor, and when she goes to the hospital, has nothing else to protect less than the masks and the gloves.
Francisco and about 100 other participants have printed more than 5,000 masks in the last few days. Local police officers then distribute them. The lack of basic protective gear at Spanish medical facilities is getting worse. About 1 in 10 people newly infected with the coronavirus work in healthcare, according to official statistics. Insiders describe the sanitary situation in many hospitals and clinics as shocking. And while the creativity of private initiatives is impressive, some Spaniards start to ask questions about the responsibility of the government. Why does the state seem to be so ill-prepared for a crisis like this? And why did the government not start to stockpile protective gear early on? Francisco is too busy to dwell on questions like these. He's motivated by the many expressions of gratitude and pictures of people thankful to have his urgently needed protective gear.
And Jan-Philipp Scholz joins us from the Spanish city of Seville. Welcome, Jan-Philipp. Let's start with that question you posed at the end of your report. How does the Spanish government explain its lack of preparation?
It doesn't explain it very well, in fact. Of course, Spain is not alone in this situation. Countries all over the world have been ill-prepared for a crisis of this dimension. But I think there are some factors that make Spain especially vulnerable. First of all, it's a factor that the current government can't be blamed for, but rather previous governments. It's the massive cost-cutting in the health sector since the last financial crisis in 2008. Second reason is something that the current government can be blamed for. It's the very slow response to the crisis. There has been no sufficient testing in the beginning of the outbreak. And also later on, the response was slow. The very strict measures have only been in place when the death rate was already quite high.
And so where will Spain go to try and get the protective equipment it needs?
Well, Spain is trying to use all channels available at the moment to purchase protective gear. It has bought medical equipment in China for several hundred million euros. Unfortunately, some of the protective gear has already turned out to be faulty. Spain is also relying on the stock of its military, like a lot of other countries. It has asked European partners for help. It has asked NATO allies for help. But I think many people's nerves are on edge at the moment. The head of the Confederation of Medical Unions in Spain has accused the government of repeating lies and false promises. And some people have already gone to court accusing the government of neglecting its duty to protect.
Now, lots of places around the world, including here in Germany, they're now mandating the use of face masks in certain situations. And what's the situation there in Spain?
There is no official regulation regarding the use of face masks in Spain, also probably because the professional masks should be for medical personnel, for the people that need it the most. However, the measures here are among the strictest in the world. You are not allowed to go out for a walk anymore. If you don't work in the so-called essential business sectors, you are not allowed to go to work anymore. And also, what is special in Spain is the fact that the people are very disciplined in following these regulations.
Good talking to you. Thanks for joining us. Jan-Philipp Scholz in Seville. Well, Afghanistan has recorded nearly 200 coronavirus cases and 4 deaths. Authorities there are taking steps to halt the spread of infection. But after years of war, the health system is weak and would be overwhelmed if the number of cases grows as it has in other countries. The country's problems are exacerbated by the return of thousands of people from Iran, one of the countries worst hit by Covid-19.
Spraying down the streets of Kabul in a desperate attempt to stave off a deadly disease. Afghanistan is one of the world's poorest countries. Its healthcare system is no match for a pandemic that's spreading across the globe like wildfire. As the number of coronavirus cases here rises, the government is taking measures to contain the outbreak. The western city of Herat is eerily calm. Shops and mosques have been ordered to shut down.
If the coronavirus keeps spreading, there'll be a humanitarian catastrophe. The government must take serious measures to help. Like most Afghans, the residents of Herat are poor.
The government has ordered the release of hundreds of inmates to prevent crowded jails from becoming infection hotspots. But Afghanistan has bigger worries than its prison population. Millions of Afghans have been displaced during years of conflict. Many have fled to neighboring Iran, one of the countries worst hit by the coronavirus pandemic. Those people are now streaming back in their thousands. All are potential carriers of the disease.
The number of Afghan refugees returning has increased massively. They're afraid of the coronavirus in Iran, and they're no longer finding work because of the economic downturn there. The Afghan government is concerned about the huge number of people returning.
Among the most vulnerable to the virus is Afghanistan's internally displaced population. Many of them live in sprawling camps on the outskirts of Herat, which is close to the Iranian border. Here, survival is already a daily struggle. Camp residents depend on critical help from overstretched international aid agencies, whose work is now made even more difficult by the global pandemic.
So how do you protect refugees during a global pandemic? Jan Egeland is Secretary-General of the Norwegian Refugee Council. Welcome to DW. How dangerous is the coronavirus pandemic for people in displacement camps like the Afghans we saw?
Well, it is horribly dangerous because, remember, the displaced, the refugees have fled from their homes, from their communities, from their space, from their hospitals that may be bombed, to small confined spaces very often where they thought they were safe. Now these places, camps, settlements, may be traps where the virus will thrive and humans will be very, very vulnerable. So we are, the Norwegian Refugee Council, working very hard in Afghanistan, in Iran, and in 30 other countries. We're trying to provide more hand-washing facilities, more water and sanitation. We're trying to also provide more space for the refugees so they can have some physical distance. And perhaps we will also be able to put up quarantine tents and the like. But it's a race against the clock. We're overwhelmed, we're overstretched.
It's interesting, isn't it? The very things that you're trying to provide as aid agencies, water, space, sanitation, those are exactly the things that were missing or being complained about before this pandemic hit.
Indeed. So we try to tell refugees, displaced people, to wash their hands all the time, keep a distance, not spread the disease, stay in their own quarters. They tell us, well, if we do not work in the informal sector, we will starve. We have no clean water. How can we wash our hands all the time? And we are 10 people per tent, and the next tent is 2 meters away. How can we have a physical distance? So I think this is really a moment of reflection for the robust North, from where the virus now spreads and where it's created havoc in New York and Spain and Italy. It's spreading to the vulnerable South and to the ultra-vulnerable, which are the displaced and the refugees. There must be solidarity now. There must be more injection of humanitarian aid.
OK, so let's... forgive me for interrupting. I'd just like to pick up on that point. When you talk about the robust North, which, of course, is also fighting this pandemic, how do you respond when industrialised host countries say, well, we don't have the resources to protect migrants, we're already struggling to protect our own populations?
Well, everybody's struggling to protect their own population, and we've all been in quarantine. I was just 2 weeks in quarantine because I came from abroad here to Oslo. But since we're all in the same boat, and since there will be a flattening of the curve in the north because of all of these enormous measures, it is in our interest and in conformity with our ideals to not let the virus get permanent strongholds in the south and in places like Afghanistan or Iran. So, of course, there has to be the same kind of packages for international solidarity that there is now for national solidarity. If it's only America first, Europe first, Russia first, and not humanity first, it will come back to haunt us forever. We're begging. Let's look at this as an international effort.
Good talking to you, Jan Egeland, Secretary-General of the Norwegian Refugee Council. Thank you so much.
Thank you.